If there is something deeper, we may not want to probe too much at first anyways, because we could inadvertently traumatize our clients. Symptom healing can work even if we don't dig deeper. So I have clients who say, how deep are you going to dig? And I always say, we're not digging deep. You never go deeper than where you need to go. A client comes in with a struggle, I want to help them experience symptom relief. I'm not going to their deepest childhood. I'm not opening up every wound and saying, okay, here, now you're a hot mess. Let's try to heal you, right? The most important thing is that you're working with symptoms, especially when it comes to somatic work or anxiety or depression or trauma symptoms. You work with the least amount of information needed, right? A lot of times with healing, a client might be so dysregulated that I'll ask them to just imagine you're going to a bookstore. We talk about this later when we talk about distancing techniques, but sometimes information or telling a narrative is too much. And so I'll say, like, imagine you're going to a bookstore. Which genre are you going to? Which section in the bookstore would the story that you would want to tell me or that you experienced, which section would it be in? Would it be in the kids section? Would it be in the adult section? Would it be in horror section, right? And I kind of ask them, what section would it be? And that's it, and then I leave it. And I once had a client say the sad section. I'm like, okay. So it's in the sad section. And is there a title that the book, could we imagine going closer to the bookshelf? What does the bookshelf look like that it would be on? It looks brown and the books all look really sad. And is there a title on the book that you have? Yeah, the title is sad. Great. Do you want to look at the first chapter? I don't want to look at any chapters, right? And then later on in therapy, we came up with like 3 different chapter headlines. Right? One was It's Dark at Night, one was All Alone, and one was What Next? And it was all about her story of sexual abuse, okay? But when she came in, she couldn't talk about anything. She had really bad symptoms of panic and anxiety, and she was acting out, had these angry outbursts, and was a very together person and had a lot of her life together, was in a loving relationship, and started having memories of her childhood sexual abuse. But all she could say was, it's sad. And when she said the word, it's sad, right, it's in the sad section. The book is called Sad. And she just burst into tears. And we stayed with that sensation of sadness. And I could tell there was a deep sadness there. And that's what we worked with. So we don't go deeper, right? She was feeling these symptoms. And I first had to help her system slowly trust me and dive into the work. And just dive into, I should say, the therapeutic relationship and say, I'm here and your sadness is welcome here.